FAVMI presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello, everyone. Welcome to Unfolding Mental Illness, a podcast by FAVMI, Family's Voice on Mental Illness, founded by Saraswati Suresh and Dr. Sachin Ganorkar. FAVMI is also the Western Zone of FACEME India, Families Alliance on Mental Illness, founded by Dr. Nirmala Srinivasan. We are a collective of family carers advocating for the wellness, dignity, and rights of persons with mental illness and their families, and we strive to create informed, compassionate, and stigma-free conversations around mental health. In today's episode, we explore a topic that is widely spoken about, often misunderstood, and frequently misused: understanding narcissistic personality disorder beyond the label. This episode is especially meaningful to us because it emerged from the suggestions and feedback of a few members of our community who expressed a need for deeper clarity, responsible understanding, and guidance around this subject. Their voices continue to shape the conversation we bring to this platform. In popular culture and social media, the word narcissist is used very loosely and sometimes harshly. But behind this label, I would say there lies a complex mental health situation or a condition that deserves a deeper, responsible, and a more compassionate understanding. And in this conversation today, we aim to go beyond the stereotypes to understand what NPD truly is, how it develops, the patterns, the impact, the label, and what healing and support can realistically look like. And today, to have this conversation, we are honored to be joined by Dr. Avinash De Sousa, the consultant psychiatrist and psychotherapist based in Santa Cruz West, Mumbai. Dr. De Sousa is the founding trustee of the De Sousa Foundation, an organization dedicated to mental health awareness across diverse sectors. With over 950 publications in national and international journals, he's a respected academician, a clinician, a researcher, a speaker, a postgraduate teacher, and most importantly, he brings a deeply human perspective to his work in mental health. And we are truly honored to have him in our show because only such experienced doctors can help us understand such complex topics. And we hope that this insightful and meaningful conversation will help us to understand better, not NPD, not as a label, but as a mental health condition. Welcome, Doctor. It's a privilege to have you as on this show, Doctor.
Thank you so much for having me.
Yeah. So we'll first start with the first question of understanding what is narcissistic personality disorder. If you can explain to us, with real life stories, with your experience in relationship to situations like family, work relationships, parenting, etc.
So I think, there are two things which I think we will start with. One is that you have a lot of people who have uh, some elements of narcissism everywhere in our life, whether it is at the workplace, whether it is at home, whether it is with family. And but very important thing for our viewers to understand is that not everybody has narcissistic personality disorder. So, because what has happened is, I think in COVID, there was a huge amount of posts on social media related to narcissism, and people began to overdiagnose, people around themselves, and they started loosely using the word narcissist, narcissistic tendencies. My husband is narcissist, my father is narcissist, my brother is not. So that's how these things came into the picture. Now, see, a narcissist is someone who doesn't really care so much for other people. For them, people are a source of supply. So I can be a source of supply of love. I can be a source of supply of money. I can be a source of supply of affection. I can be doing work for you. I can cook for you. I'm a source of some supply. And as long as the supply is coming, I'm good to you. The moment I stop providing that supply, I become a very bad person. That is what narcissistic people feel. They also are a little selfish, in fact, a lot selfish. They're worried only about their needs, and they feel everyone is stupid and hopeless compared to them. So we see bosses who keep feeling that everybody knows nothing and only they know everything. They will manipulate people in the office, make them overwork, make them do all sorts of things. But when it comes to giving a promotion or a raise, it doesn't happen. We have spouses, husbands and wives, where one husband is or one wife is very dominating, very aggressive, and takes all the decisions, makes the other partner feel that they don't know anything, they're good for nothing. And sometimes they will show a lot of love towards the partner, sometimes they will show a lot of hate towards the partner. So the partner also gets confused that I don't know, what is this? Yesterday he took me out for dinner and we had such a good time, and today he's so aggressive and violent and telling me that I'm good for nothing. So the partner also gets confused, and they will make the other person feel that you're at fault and you're wrong. And because of that, the other person actually begins to feel that, oh, probably there is something wrong with me. He's right. So that is what happens. Well, in a love relationship, narcissism can also come in. Sometimes the narcissist is always searching for people to, dominate. So for them, falling in love is like a mission. They want to sort of conquer someone. It's a conquest. So once they have control over someone, that person has no longer any meaning for them. As long as a person is difficult to get, that is what is very difficult, what is enjoyable for them in their love affairs. And even in their love affairs, they will, initially try to mirror the person, meaning they will try to show that I have the same interests, I have the same characteristics, we have common personality factors that bond us, so that people come together. And afterwards, what happens is that they begin to feel that, and then they will also, shower the other person with so many compliments and gifts that the other person actually feels that this guy is the nicest person in the world, and there is no one else who I can, find. And slowly they will isolate that person from other people and, bring that person into a total dependency on themselves. And finally, that is what will probably happen. Now, you also see that you have parents sometimes who are very narcissistic. So they, tend to make their children feel that they're good for nothing. They get upset with their children. They always expect the child to do anything the child does is not enough. They'll always feel that the child is not performing up to the mark. So if the child gets 95 out of 100, they'll be more worried as to where the 5 marks went rather than appreciating the fact that the child has got 95. And comparison to other children is always there. Oh, see, because they always want to have this so-called ideal child who's excellent in everything, which is not going to happen. So, and I think it's a factor which is transmitted across generations. So if you have a parent who's narcissistic, the child becomes also narcissistic and transmits the same to his children. And if you ask me, subtle shades of narcissism are present in a lot of people in the population. So if I take 100 people, at least 70 of us will have some shades of narcissism. Now, for example, I love myself. That's also a shade of narcissism. But I don't love myself so much that I will not bother about others. So I may say, no, I really love myself. So I want to pamper myself. So today I will, buy some clothes. I will go for a foot massage. I want to. But at the same time, if my wife is unwell, I will not say, no, hell with you. I'm going for shopping. No, I will stay with my wife and take care of her. So while I love myself, I also love others. So I can be having positive narcissistic traits also. But if I was a full-blown narcissistic individual, I would have told my wife, whole time you're falling ill on a day like this, that you should ideally come out with me. See, you're sick, you're good for nothing, your immunity is low, this is that. And I would just probably give her some medicine and go off to do all that I want without bothering about her. So there are differences. So there are also degrees of severity when it comes to narcissism. So we have different types of people, and all of us, even you, me, everybody. I'm not saying that the psychiatrist is immune. All of us have some personality flaws. All of us have some. So we have some positives and some negatives. That's how humans are. There's nobody who's totally positive. So this is how I would say, narcissism exists in society. So we have narcissistic traits or features which are there, but we can't say everybody has narcissistic personality disorder. It's a very different connotation. So that's how I would start.
So, so when does this then become pathologically a mental health situation? How does one identify these traits? Basically, is it through behavior? Like you said, the person becomes controlling and dominating. So, at what point in time, I mean, for a family to realize that he needs to seek help?
Okay, so what happens is that if it becomes a pattern which is pervasive and is happening again and again, and people are suffering as a result of it. So the wife is suffering, the wife's family is suffering, the children are suffering, and this person doesn't feel anything he's doing is wrong, and he's totally wanting to control everything. And the wife says that I think if you go on like this, I don't think I will stay with you and I will leave you and go away. And he says, go, let me see who's going to keep you. Let me see who's going to look after you. You will be on the road and I will not give you a divorce. I'm going to, see how you get a divorce. So that whole tendency is they don't want to give freedom to anybody. So for them, the biggest uh, negative fact is if someone tries to escape their clutches and escapes their freedom. So that is, so they will also dominate the children. I have decided you will go to this tuition, means you will go to this tuition only. I have decided you will go to this coaching class. And if the wife says there are many children who are going to another coaching class, he'll say, cha cha, you don't know anything, don't teach me. So that is one. Secondly, they will only think about themselves. So they will go on an office trip with their colleagues, they'll go for a conference, they'll go, but they will not take the family out at times, so family needs are not looked after. They may get aggressive, they may get violent, they may be domestic violence, they may hit the children. So when all these traits are there and it's pervasive, that it's there over a period of time and it's lifelong, then it becomes a problem. See, one of the biggest things people have to understand is that in narcissistic personality disorder, which is pathological, the family members suffer. The person doesn't suffer who's ill, and he doesn't believe he's ill. So it is the family members who usually come to the psychiatrist that, sir, see, this is my husband and this is my father and this is, these are the problems. And then we'll say, probably, okay. But, and when you tell him, "Ki, why don't you come for counseling?" He's saying, you're ill, you're mad, you're depressed, you need help. I don't think I need help. I'm perfectly fine. So they will never come for help. It is the family members who are traumatized by them who will, often come for help. So that's what happens.
Uh, I mean, from what you're telling me is that there are patterns which, once the family starts noticing on the controlling and, the behavioral aspect. But why does it, I mean, to me, when you were talking, some of these are quite normal. Uh, at times, even I say that to my children, say that they go to this classes only, but I'm not narcissistic in that sense. It's
Correct.
I look at it as my understanding of ability to understand it much better than the others. So at what time then these patterns that I realize and then I start with early interventions?
Okay, so we will take your own example. Like you said that I feel that this particular class is good for my
Uh,
child. Now, if your child comes and says, "Ki, no, no, mama, you are right, but now this class has got these certain professors. There's another class, and I have spoken to children, and I think it's a better class. In fact, this class has a morning timing, this has an evening timing, so this will suit my schedule better." You are open to hearing them. You're open to trying to find out why they want to go there. You will not say, "I don't want to hear anything." You will hear, you will, so, and then you will sit as a family, discuss, and then, do what is best for the child. You will, if you realize, no, what my son or daughter says makes sense, you will agree with them, rather than disagree with them. So, so that also is, see, now you may say that, I've heard that this particular history teacher is good, so you go for tuitions here. And he may say, ki, no, no, mama, there is a teacher in my own school who's good, and she's only 5 minutes from the house. That other teacher is half an hour from the house. So I will save travel time. You will agree to what your child says. You'll say, no, what he's saying makes a lot of sense. But if you are narcissistic, you will say, no, don't teach me anything. Just shut up. I know what is good for you. So that is the difference between, normalcy and abnormalcy.
Okay, I now
Yeah,
understand from
yeah, yeah.
there's a give and take in in the conversation and the
See,
relationship.
we all have our opinions. See,
Yes,
I'm a father of a 17-year-old. Okay, I have my opinion. Like I'll tell him ki I think this is better. But he'll tell me ki no, Papa, at your time maybe this was the thinking. In our time, now we follow this or whatever. So I will be open to listening to him. I will not tell him, no, I don't care. You're only going to do this. So having an opinion
yeah.
and believing that yours is the only choice, there are two different things, which are there.
No, I understand from where you're
Yeah,
coming now
yeah,
from. I mean, initially I was trying to,
yeah, yeah.
because I said, because all these, what you were saying is all of us do it
Yeah.
at home or at work or things like that. But
See,
yes,
another small example I'll give you. Like, Sunday, the family wants to go for lunch.
yeah,
Okay, so I will say, no, I want to eat Indian food. My wife will say, no, I want to eat Italian food. My son will say, no, I want to eat Chinese food.
huh,
So, as a family, we'll say, chalo, mall jayenge. Everyone will get, everything. I will get Indian, you will get the food court has got all the choices. So we'll go
correct.
to the mall. Everyone orders what they want and everyone is happy. But
Huh,
if I'm narcissistic, I'll say, मैंने बोल दिया ना, I'm paying the bill, I'm the head of this family. I've said Indian, you bloody well eat Indian. So then, so there is a difference there.
yeah,
Uh,
okay. Now I understood.
yeah.
There's no,
Yes, yes.
there is no give and take. It's
Yeah,
what I
yeah.
say, you
No,
have
I
to
am
do.
giving multiple examples so that, viewers
Yes,
get perspectives and understand, that, yeah,
yeah. I think this entire subject will have to be explained with
yeah,
examples,
yeah,
because
yeah.
otherwise it's a very complex, I mean, it's very loosely used, I would say,
Yeah, that's
subject.
why I'm purposely saying it because a lot of people come to my clinic today and say, ki, doctor, my husband is narcissistic personality. I said, no, let me first see him. Let me decide. You can't just label him. No, no, I have gone on Instagram and I'm very sure he's narcissistic. No, but that is not the way to diagnose.
Yeah,
Yeah,
I understand that.
yeah.
Okay. Uh, uh, so now that we have understood what is narcissistic, the next question is, do you see that certain personality patterns precede over mere severe conditions, like traits sometimes evolving into bipolar spectrums, or, you're saying that shy or avoidant or suspicious childhood traits often reported in people later who have been diagnosed with schizophrenia. So is there a pattern of those kinds?
Okay, so one of the very important things in narcissistic personality is that uh, they are very aggressive at times, or they can be very passive aggressive, both.
Okay.
So like I always say that they can sometimes, they believe in non-violence, but they can be aggressively non-violent, or they can get violent and aggressive both. So they just shut off. We will not talk to the anybody now for next 2 days in the house. So it becomes so bad that the other person says, yeah, chodo chalo, main hi jaake sorry bolta hu, so that the issue gets sorted out. And when you go to say sorry, all your faults will be counted to you and said, this that, until you say, acha baba, okay, I am only sorry. Then they think, no, we have won, that way. So that is one. Or they may get violent, they'll get aggressive, there'll be violence, breaking things, all that can happen. So that is one trait. The other trait that we also see is that they do not take defeat easily. So let's say if they're in a family gathering and people are talking, and suppose someone says, that, I think your wife has better knowledge of this subject than you, or so either partner or husband has better. The other partner, if they're narcissistic, they'll say, no, no, where she has knowledge, she has learned because of me only, and I have only taught her. Meaning, they would like to take credit for that. So that kind of, they'll never ever give credit to anyone else. They will want to take credit themselves only. Similarly, a boss in office, he may tell the junior to make a presentation. He may make some changes, but he'll put his name and present and not give any credit to the junior. So that can also happen. So they will never want anyone. See, he only I must grow. No one else should grow. So there is, so like I always say, sabka saath, sabka vikas, LIC says, they don't have that policy. Their thing is Mera Vikas. That is their only agenda, which is there. So that's
Everything is
another
about
trait. So
I.
people feel, he's a very selfish person.
Huh.
They will, but as long as, you're working for him and you're doing everything, he's very happy with you. So
Okay.
they will, give you small gifts.
Huh.
Like, for example, what they will do is, if you're doing some work for them or whatever, they'll say, एक काम करो तुम कल ऑफिस मत आओ घर से ही काम करो, you do this at home, and you want to take an off, you sign the muster and go take an off, it's okay. So the person feel very nice ki, okay, my boss is being good to me. But the bigger loss is you're not getting any credit for anything. You're just being used and thrown. That is what they don't. And they're not even bothered if people leave. See,
Okay.
if I say now I'm walking out of this relationship, they
Hmm.
will say, go, I will get a lot of people. The boyfriend says, I'm leaving you, or girlfriend says, I'm leaving you. The other partner says, go, let me see how you'll get another boyfriend or girlfriend. Whereas I know one I will get in 1 week, I will have a new girlfriend. So they have that kind of attitude. So there's no value for the relationship. So this is a very common thing which will be there. And they also have this thing. One day they'll be so thankful that you're a part of their life and this and that. And one day they'll tell you that you're good for nothing. In fact, if it was not for me, no one would ever fallen in love with you. And they'll make you feel so bad. So that kind of thing. So it could be. And the most common, one of the commonest characteristics of narcissistic people is they will always ruin occasions. So when
Okay.
it is birthdays or anniversaries, they will always do something ki sab kuch kharab ho jaye, that, and they want to be the center of attention. If they're not the center of attention, they don't like it.
Okay. Okay. But does this proceed over, with severe mental conditions like bipolar or schizophrenia? Is there a
So
connection to that?
many of them may have a history in their
Ah.
family of severe mental conditions.
Hmm.
Sometimes mood swings are very common. So this bipolar and depression are very common in people with narcissism.
Okay.
Schizophrenia, not to a large extent.
Okay.
Many individuals with narcissism may also be chronic alcohol users. They may be chronic drug users. So that, in fact, happens. In
Hmm.
fact, narcissism can coexist with other personality disorders. So you
Okay.
can have a combination of narcissism and antisocial personality disorders. Like, a simple example, like you taken somebody who's a criminal, a hardcore criminal, or
Hmm.
an underworld don. I mean, there's a combination of narcissism and antisocial personality,
Hmm.
combined. So that kind of a thing where they are doing all the criminality, but at the same time, they feel no one can catch me, nothing will happen to me. They
Hmm.
have that, kind of aura. So that kind of thing. So, like, an example of a combination of narcissism and antisocial is Saddam Hussein. If you look at it,
Ah,
even when he was in the trial court, he didn't care.
correct.
He said he didn't have any, and of course, he probably developed mental illness also later. So he
Hmm.
didn't have any he was
Yeah.
not bothered. He said, I'm still the president of Iraq. He didn't really bother. He went into that fantasy mode.
Hmm.
Or, for example, if you see in the movie Don, the character of Don, I'm not talking about the actor here, but the character Don shows narcissistic traits and, is antisocial also. So there is criminality and all that. But then the thing is that the dialogue is narcissistic. Don ko pakadna mumkin hi nahi hai, whatever
Yeah.
namumkin hai, they feel nothing will catch them. So this is a narcissistic belief that nothing can, happen to me. Again, nothing about the actor. I'm talking about
The
the
character.
character. Yeah,
I
just to
got it.
clarify. Yeah, so that it's that way. The character. So it has those shades.
Ah.
So we see certain Bollywood figures have this. We see certain politicians have this. We see certain doctors have this. We see certain engineers have this. Certain corporate people have this. We have some teachers who have this. So, it's like there are some teachers in a coaching class, who will say either you do this or get out. You can leave my class and go. I don't care. Matlab, they don't really, if the parent goes to try and tell them something, they don't want to listen to the parent. I mean, I have come across some teachers who are like this. We even have some students who are like that. They think they know everything. They don't need a teacher to tell them. So it's a very common thing across sectors. It is not something which is seen only here.
In a certain kind of
Yeah,
people,
yeah,
or
yeah.
in fact,
And no social strata. It can be seen even right from
across.
lower strata to middle class to higher strata. So the amount of money you have has got nothing to do with narcissism per
Narcissism.
se. Yeah.
Yeah. So, in fact, my next question was on anti-PD versus which you have answered. Just one question before I hand it to Dr. Sachin is, how different would it be for an anti social PD versus NPD? how would you then identify the difference?
NPD and what other?
Social
Yeah. So see, the antisocial personality is one who there are overlapping characteristics. For example, certain amount of lying, the narcissist will also do. The antisocial will also do. Certain amount of manipulation, both personalities will do. Aggression may be seen in both personalities. But the pure narcissistic individual may not indulge in criminality because his own image is very important. He will not want his image to get tarnished for any reason. He may hire someone to do the job, but he will not do it himself. But in antisocial personality, they may engage in some criminal acts. They may engage in multiple things which are illegal. And even if they are caught, it doesn't matter to them. So it's like any publicity is good publicity. So it doesn't really matter to them that way. So they have these features which, and also they may indulge into a lot of substance use. And they may sometimes engage in sexual crime. These are things which we may not see in or murder and other things which we may not see always in a narcissistic personality.
Okay.
The emotional manipulation is far more than the physical act of crime, in narcissism.
Okay. So it's all
And the
about
best part is antisocial, you know that my lover is dangerous. He can kill someone. You know that because his history is there. He'll tell you, मैंने 6 लोग को मार डाला है, मैंने एक किया." You know. Whereas in narcissism, you don't realize. And it's only after you're fully in love with him later that, their whole garb falls. And then you are stuck because you're so dependent on them now that, you wonder, what will I do without him? So you say, "ठीक है, he has these problems, but he's also good to me. So let me manage." And you continue to remain there
without realizing that you're
without
actually.
realizing that you're in this web of narcissistic abuse
Yeah.
that is happening.
Yeah, so true. I'll hand it over to Dr. Sachin to take it forward, sir.
Yeah. Thank you, Saraswati. Thank you for setting this up. And thank you, Dr. De Sousa, for your valuable time. I've heard you speaking in Pune on internet addiction 2 years back. And we also heard you in ADHD, and also now. I think you're a treasure of knowledge, and it's a deep gratitude. And that Saraswati set this entire thing up. Actually, I asked many of my friends to put questions after Saraswati said that we had that podcast, and we found it very difficult to not go to the clinical side. And that's why
Correct.
that's why we said that we'll just keep it simple and just have this story narration going on. And just to take forward from Saraswati's side, how do you differentiate empathy, what a NPD or a person with that disorder has, and a normal person's empathy? So
Okay.
normally people say that there is no empathy. They treat people, as you were mentioning before, they treat people very roughly. And just to take it forward, my friends also gave me examples of personalities like maybe I would not know, maybe Pandit Ravi Shankar, or they say that they mentioned movies like Gaslight, which is a 1944 psychological thriller in Hollywood, which spoke about trauma bonding, etc. So how would you actually comment about this entire
Okay.
all these
Okay.
themes?
So, see, it will be very wrong to say that narcissistic people do not have empathy. They probably have a lower level of empathy, far lower level of empathy compared to, say, you and me. So, to give you a very simple example, if a person matters to them, then their levels of empathy are there for them till they matter. Then they go away. So it's more of a very low level of empathy, and sometimes they may exhibit a pseudo empathy in the sense they may pretend to be very empathetic to get their work done. And someone may feel, "Oh, he's such a kind person," or "he's such a nice person." But their whole agenda is only to get the job done. They're not really, once the job is done, they don't really, care for you. Whereas we all, of course, have empathetic tendencies where we feel for others, we understand others, we, know what they're sort of going through and whatever. So that is one aspect. Well, with regard to the musician you mentioned, I don't think we can talk about an individual personality, but one thing I will tell you that a lot of, there are many people who are very passionate about their work, or whether it is in the arts sector or in the music sector, and a lot of people misconstrue this as being narcissistic. It may not be narcissistic. It is just that they value their work so much So they prefer to be reserved. They prefer not to mix with too many people. They do not develop attachments because the only attachment is their work. And so being proud is not the same as being narcissistic. So, or, suppose I tell you that my fee for the assignment is 50,000, and you will tell me, "Ki, sir, no, can you reduce your fees?" And I'd say, see, there are a lot of people who will do it at 20 and 25 and 30, but for I know my quality and I know my caliber, so I charge so much. Now, so you may say, "Sir, we cannot afford you, so we will, go to someone cheaper." And I'll say, fine, it's okay. So, but that doesn't mean I'm being proud. It's just that I value my work and my expertise, so and I charge for that. But that is not the reason why you can call me, narcissistic. But at the same time, let's say if somebody from an orphanage comes to me and tells me, "Ki, can you have a concert and can you do this?" I may do it free. So that doesn't mean I'm narcissistic. But if what happens invariably is that, so there's a difference between being proud and particular and being narcissistic. And then when I'm narcissistic, I really don't care. Even I would charge 50,000 to the orphanage also. I wouldn't really bother. I would say they are getting donations, they can pay me. There is no reason. There's nothing like a good cause. My time is going, my time is money. I would, think that way. Or I may pretend to do it free and from a social image perspective, but be very unhappy and crib about it later that, "Ki, I have to keep doing these free things just for my image and I don't like it," or, that way, or, those kind of things. So this is a little different kind of, perspective. See, gaslighting is one of the things which people who have narcissism do. So what they do is, they will make you feel that there's something wrong with you. "I think you're mentally ill. I think you're not proper. And I think you need help. I think you should see a counselor." So much so that you'll actually begin to feel, "I think, yeah, there is a problem with me only. He's absolutely right." So they will manipulate you in such a way that you begin to feel that you have a problem. And then they will manipulate you in every way. And you get so submissive and that listen to them fully. And so that is what I would say comes to light there.
Yeah, thank you, sir. So I spoke to a lot of friends, and they said personality disorders come last in their area of diagnosis. I think they exclude everything else, and that is the last thing which comes. So, how do general people like the audience who's listening to this podcast understand why understanding narcissistic personality disorder is important, and what is the reason why they should understand these disorders?
Okay. So, see, everybody has a personality. Okay. Myself, you, madam, all of us have personalities. Okay. Now, we have some positive traits and we have some negative traits. So, in the sense that, let's say, if you're too particular about cleanliness, now that may be a positive trait for you, but not everyone may be able to keep up to that level of cleanliness. So, it may seem like a negative trait for someone else, that way. Or let's say I'm very particular about deadlines. 9:30 means 9:30. And if you're late, then I get very upset. Now, some people may say, "Kya hai, 5-10 minute mein kya hoga?" And they will not worry. But for me, it is very upsetting. So now, whether it is positive or negative, it is for people to, you know, judge or decide or whatever. So that kind of a thing. Now, some people study till 3 a.m. Some people get up at 4 a.m. Both can be disturbing to the family. So, but then he's doing his work, he's not doing anything bad. So he's not disturbing the family, he's getting up and doing his work. So, what is the harm? So each one has their own, some are more emotional, some are less emotional. Some, like I'll give you a simple example. Let's say today relatives are coming home and my wife tells me, "You have to come and meet them and sit with them." And I'll say, "What will I do? They are your relatives. What will I do by meeting them?" Now, actually, it's a fact. I really don't know them. I will have to just sit there and make some conversation. But it can happen that you'll say, "No, no, you don't socially mix at all. You're being very introvert now." Okay, I am introvert, but that doesn't mean it's a negative trait. I read, I with my patients, I talk. There is no problem. I may be introvert, but I cannot just talk to anybody. On the other hand, you're someone who's extrovert. They talk to everybody. So it is again, so there are way, it could be negative, positive, depending on, what is what. So it varies from, trait to trait. It varies from that kind of a thing. Also, what I think is very important for people to understand is that everything lies on a spectrum. So there are some people who are mildly introvert, some are very severely introvert, some are moderately introvert. So it could be similarly extrovert also, and then you have mildly extrovert. So they can talk to anyone. Moderately severe, they'll come and hug everyone as though they are their old brother or something. And that kind of thing. You have those kind of people also. And they also have those tendencies that in a party also they'll come, hi Sachin, how are you? And you will say, I don't know him so well. How come he's coming? But everyone will start looking at you all as though what has happened. So that kind of thing. Now you can call this positive, you can call this negative, whatever you want. So that kind of thing. So it is, depends on however we want to look at it. So I think uh, in practice, I would like to tell people that for us, personality disorder is a parallel diagnosis. It is never a last diagnosis. So, we may diagnose whether you have depression, anxiety, or other problems, but your personality is something which runs parallelly with this. So we look at personality parallelly. We don't look at it as, oh, he doesn't have a major problem, so it must be a personality problem. No, personality problem can coexist with the other, problems also. So that is also something which is there.
Thank you, sir. Uh, so based on this, as you said, that listeners should actually take away that I think there's a spectrum, and I think one should not immediately put somebody as positive and negative. Uh, if a personality disorder like narcissism is disturbing a family, then how do you actually set boundaries in real life for a lot of people? What are the examples of healthy boundaries and boundaries that fail with a narcissistic personality disorder? For example, I met one parent whose child had I think, a borderline disorder, and uh, because of the entire stress, I think he developed a heart condition. So sometimes I think even the families and the nearby people actually get affected. So how do you actually set up boundaries in practically? How do you cope with it?
So I remember, I mean, a year ago, I had a lady who came to me because the husband was having narcissistic tendencies. And we, of course, diagnosed that he does have a personality problem, which is there. Now, it was becoming very difficult for her and her daughter to stay there because at the same time, she was very sure that from a societal standpoint, she didn't want to leave him or have a divorce because there's a daughter involved, a daughter's future, multiple factors. And um, the husband would definitely not give her a divorce. So that was also another thing which was there. So, so I told her that, you will have to find some way by which, you have to move away from him. But then what happened was that after the daughter's 12th standard, they purposely took admission for the daughter in Pune. So they could shift from Bombay to Pune. Husband would not be able to shift because of his work. So at least Monday to Friday, they would have peace of mind. Saturday, Sunday, he would come and his criticisms and other things would continue. But they said that at least we know he's going to go on Sunday evening. So we have to just tolerate him for 2 days. And then, again, Monday to Friday, we have peace. And even on Saturday, when he would come, the daughter would invariably purposely have tuitions the whole day so that her interaction with him would be minimal. Only one day they would have had to sort of, and they said that one day we just listened to him and, managed. So they learned to coexist, with him. And then now, I mean, ahead, I mean, probably the daughter will go abroad. But the wife says, I will manage. I have lived with him for 20 years. I will now live. I don't, 25 years. I don't want to now separate out or whatever. I have learned to ignore certain things. I have learned to manage. So over a period of time, you develop. In fact, even the person living with somebody who has narcissism needs counseling and therapy because how to deal with this person. The best treatment is to be silent because the more you will respond, the more there'll be a fight. So if you're silent, the other person has to stop after some time. So, and the worst uh, insult to someone who's narcissistic is when you show them that you're not affected by what they say. That hurts them the most. So they realize that this, and they leave you alone then because they realize this person doesn't get affected by me. So I can't do anything here. It's only when they know you're getting affected, they will do more to trouble you. So that is also something which is there.
And so, how do you do this in a workplace? Because normally, if you retreat while interacting with your superiors or subordinates, for example, with the situations above, one cannot actually stay silent because it might be considered as maybe the person is not interested in working. So then, how do you deal with this in real life work situations where a lot of these interactions exist, as you mentioned earlier?
See, in real life interactions, when it is at the workplace, it's easier because you're not living with that individual. So you have to just manage him for those few hours at work and come back. You know, Post 5 o'clock, that person has no power over you. It's only till you work, whereas unlike in a family situation, you're living with that individual. So it's very different. So those factors also play a role. And another thing I tell many people is that uh, um, if you can get another job, get it. If you are not able to, cope. Now, but if you can't get another job, then you just manage. You have to learn to listen from one ear, remove from the other ear, talk to other colleagues. Everyone says, अरे यार वो तो बॉस ऐसा ही है, हम लोग सब पिस रहे हैं, but we are managing. So, so form support systems there in the office that, you will get that. But at the same time, I tell people that if you feel that there's a lot of harassment, complain to HR. Don't keep quiet. Don't think, oh, I will suffer. And for particularly for ladies, I said, you have Bosch, you have other things. You can always complain that I think, there is a problem and put things straight. Even a man can complain. So if you have a lady boss who's narcissistic and the man can complain. So I said, today we have some legal frameworks in place. HRs are very open. So I said, you can, raise your voice if you feel. People don't raise thinking they'll be sacked. So that is what, worries them. And or they'll get a bad report and the next job will be a problem. That is what worries them. So, see, the people at the lower level suffer more because for them, the job is more important. So
Right.
they, don't, whereas at a higher level, people revolt because they know now I'm at a managerial position. I can, raise my voice. But
Right.
people who are at the lower level often just suffer silently.
Very
In
true.
fact, they will come out of his room, abuse him, and be happy and go. They'll just suffer silently at that level. They don't really do anything about it.
Uh, And so, due to manipulation, sometimes people start blaming themselves. They feel that they have, I think, some problem in themselves when you interact with the person who has this disorder. So,
See,
how do
that is
actually?
why, because a boss makes them feel that way.
Correct.
They'll tell him, they'll say, तुमको कोई नौकरी देगा नहीं, तो मैं हूं इसलिए तुमको रखा हूं यहाँ. यू नो तुम्हारे जैसे आदमी को तो मैनेजर क्या, जूनियर लेवल पे भी नौकरी नहीं मिलेगा, बट मेरे कारण ही तुमको मैंने एटलीस्ट मैनेजर लेवल पे लाया हो. But the person doesn't realize he's been promoted to manager only so that this fellow could play with him. He's not, he never wanted a smart manager. He wanted a dumb manager who he could trouble. So he knew this fellow will nicely fit into my clutches, so I'll promote him. The moment if he had somebody who was very outspoken, who would say, "Sir, you can't talk to me like this, that, or," he would never promote that person. So they choose who to promote also wisely.
Got it. So, with all these situations which you have mentioned, so how should one decide that whether one should distance themselves or one should stay engaged in whatever relationships, whether it's a family relationship or it's a work relationship or anything which is happening around you? How do you actually decide, or should you meet a psychiatrist and then talk it out if because most of the people would not immediately approach it. They would always say that acha main ye dekh lunga, I'll just manage it somehow or something. So when does that person then
Right,
take
right.
that decision?
So, at this point, I will say two, three things. One is I want all your viewers to understand that you don't have to be mentally ill to see a psychiatrist. That's the first thing. Because a lot of people feel मैं पागल तो नहीं हूँ, मुझे क्यों जाना चाहिए, मेरा बॉस पागल है, उसको जाना चाहिए, मैं क्यों जाऊँ. So what is very
Correct.
important to realize is that a lot of people who are dealing with life situations, like say marital problems, work problems, they come to us for an opinion. We're not going to just diagnose, nahi, nahi, you're depressed, you're anxious. That is not our job. We don't want to label anybody. We are here to help you. So that is one. And not only psychiatrists, even psychologists and counselors. So if you feel afraid that, I don't want to go to a psychiatrist, because this whole image of psychiatrist as portrayed in media and movies is of a man who's looking to put you into a mental hospital, but we're not like that. So the thing is, you can go to a counselor who you can speak to. Counselor will only talk to you, so nothing will go wrong. So that is one. For those who are still afraid, you have an online option. So if you talk to me online, I can't do anything to you. I'm on this side, you're on that side. आप अपने घर पे बैठ के बात कर सकते हैं आराम से. So you can have your wife, somebody sitting with you also if you feel scared, and talk to me. So there is no worry. So you can always do an online consult. And then if you like me or like the others, then you can go and see them in that clinic. So it doesn't mean that, you always have to go to clinic. The online option is always there. So that is one. Secondly, uh, not all problems have solutions. It's very important. But we can help you manage the problem better. So maybe your reactivity to certain problems have to change. Your attitude to certain problems have to change. The way you handle certain people have to change. So it's not that the problem may change. So it is something like that. Now I will give you a very simple example of a small thing. So I had a couple that once met me, and the husband was very particular about cleanliness, and the wife was the type who was not bothered. Now there is no offense here to anybody. Each one has their own personality. So he told me, "Ki doctor, I like my house to be spick and span." This is what the man said. And he said, "See, when my wife comes from work, she will throw her slippers under the sofa. She will throw her bag on the sofa, and her dupatta is lying there. And this irritates me. And then, I tell her, ki, nahi, sab apna jagah pe rakho." And then the fight starts, he says, And every evening, this is the whole problem. Whereas when I come from a young age, my parents have trained me. So I will put my clothes for washing. I will fold my pant, fold my belt, put it in the hanger. I'm very particular about all these things, but she is not. And she'll say, "Oh, सोने के पहले डालूंगी," and it irritates me. And then sometimes it is lying till the next morning, so it will irritate me. So he came to me and he said, "Doctor, treat her, do something." मतलब, he was that way. So I told him, "See," I said, "प्रॉब्लम आपको है, ठीक है, उनको नहीं है." तो I said, rather than tell her क्यों नहीं रखा है, so I said, "Tell her, ki, darling, can I put your dupatta properly? Can I, because I said that is your problem. So she says, "Yeah, do whatever you want. I don't care. You put it properly." So I said, so he came back after 10 days and he said, "No, I'm very comfortable now because, I only fold it and put it. I only put her bag in the right place. I put her slippers in the shoe rack and I don't tell her anything." And then she'll come and say, "How was your day? We have tea, we have everything, nothing, there is no fight." So sometimes, you have to adapt to the other personality also, rather than look at changing the personality, from that point of view. So it's something like this, if you're like, if you have a partner who's short tempered, rather than you get angry, tell her, "No, you look so beautiful when you're angry." Change the situation. You have to learn to manage that rather than get upset. If both are going to get upset, then there is, going to be, a fight always. So, I mean, I always say, I tell people, so he says that, so one, like I tell patients, add some humor to your life. So, one lady came to my clinic and said, "मेरे husband सारी decisions गलत ही लेते." मैंने बोला, "आपसे शादी किया, ये भी गलत decision लिया." So then she started laughing. So I said, "देखो, सब decision उसके गलत नहीं है, एक तो अच्छा decision लिया कि आपसे शादी किया, अभी आप है तो आप उनके decision सही कर रहे हैं." So automatically she says, "ये वो नहीं सोचते." So I said, "नहीं," I said, "देखो, कुछ उनको करने दो, उनसे गलतियां होने दो, उनको सीखने दो, rather than you telling him, 'Don't do this, don't do that,' let him make some mistakes." So I said, "देखो, 5,000 रुपए का नुकसान होगा, हो जाने दीजिए, लेट हिम रियलाइज। हाँ, लाखों का नुकसान है तो रोकिए, उसको मत करने दीजिए." सो आई टोल्ड हिम, लेट हिम ऑल्सो लर्न, नो, डोंट ट्राई टू मदर हिम the whole time. So sometimes, we have to tell people in this manner, see, no one is wrong here. She's also right, he's also right. He's saying, "I have no freedom to do anything." She's saying he doesn't do anything right. Now, poor fellow has made some mistakes. She's also right. She's also fed up that some mistakes have happened. But all they need to do is adjust, to each other. So this is how normal personality patterns can be dealt with. Of course, when it's extreme, you do need help. Now, see, another thing, which I will want to tell all your viewers is that I've said this in many of my talks, that every year you get a physical health checkup done. You get your blood test done. In 25 years of my career, I have never had a patient who's come to me and said, Sir, I've come for my regular mental health checkup. No annual mental health checkup. I have come. You're getting your lipids done every 6 months, your sugars done every 6 months, you're checking your BP every month. No one ever comes to me and says, Sir, I'm in a stressful environment. My work is stressful. I mean, there is no problem at work, but there are deadlines. I'm working in, say, share market, this, that. So I just want to see, am I mentally healthy? People come to us only after they have a problem. कि डिप्रेस हो गए, ब्रेक डाउन हो गया, आफ्टर दैट दे विल कम टू अस. No one comes to us. It's like servicing a car. I always say that just like you get your car service, get your mental health service also done. It is something which should happen every 6 months. Once you've driven yourself for so many kilometers, so एक बार 6 महीना stress में हो गया, तो come and get yourself recharged. Why not? But people don't come. They think नहीं, अरे नहीं नहीं, मैं psychiatrist के पास क्यों जाऊँ? So that is the first thought. So that fear is also there. And I mean, see, psychiatrists are human. I always say this. I'm a psychiatrist. I'm not 24 hours a psychiatrist. I'm also a father. I'm also a brother. I'm a friend. I'm a son. I'm a father. So I also have multiple roles. I understand, what is happening. So you can come and see, the psychiatrist is not going to cure your problem. He's only going to give you solutions. You go, you try, you come back, tell him whether it worked, it didn't work. We'll try and give you some other solutions. So, and out of maybe 10 things that are worrying you, we may solve five. Five we may not be able to solve, which I understand. I cannot solve everything. But nevertheless, we'll have to try and, help you in whatever way we can. Or we may tell you sleep better. We may tell you eat better. We may tell you start some yoga, do something so that you relax. So we may give you some guidelines. So this is what I would sort of advise to people, that please visit a counselor or a mental health professional, even if it means to get yourself or your loved ones screened. Is there a problem? So, or if you feel nahi kuch problem hai, but abhi I don't want to take my husband, wife, brother, sister, mother right now. You go yourself and talk to the counselor and find out ki this is what my mother or father or brother or sister or son is facing. Is there a problem? Is there no problem? At least get that screening done once. And if you get that done once, then you can decide further whether you want to take help, not take help, what to do.
No, sir. Thank you, sir. That's a wonderful explanation. I remember from your last talk that you had mentioned about this, that I think it is only not only for disorders, but even for general problems in life, we should actually come and speak to a psychiatrist. So all these suggestions have been, this are wonderful examples which you have given. Just wanted to ask you like one of the last questions, and this has been a very good conversation. Uh, is that when you look at the television series or web series, so maybe we grew up in an area of Doordarshan. Now, I think a lot of uh, shows show that a person has some disorder and everything evil is assigned to either a mental disorder or to a personality disorder. So, how do a lay person, like people who are listening to this, understand that there's something called narcissism, there's something called narcissistic trait, and they're mental disorders, and they might not be uh, connected to evil in a sense. And there might be people, normal people, who would also be doing some evil acts. So normally, our media today has, as you rightly said, in the COVID times, everything evil has been assigned that you have, you might be having some kind of a mental disorder or a problem which makes you do something irrational or evil.
Okay. Since you mentioned web series, I recently did one web series called Honeymoon Se Hatya, which is on Z5. So there they have taken psychiatrist's opinion on why women kill their husbands. There were 5 cases, like there was a Sonam Raghuvanshi Meghalaya case. There were other cases which have all been in the newspapers for many months. So they have documented that and taken our opinions. So there also many shades of narcissism have been explained by me in very simple terms. It's in Hindi. The entire show is in Hindi. So people who want to see that can see that. But like you rightly said, you know, the most extreme aspects are shown by web series very often, or by, so we often have that as the benchmark. Now what is very important to understand is key, uh, when anyone has a few features, it is important that help is sought at that time. So if you feel key नहीं, कुछ कुछ थोड़े प्रॉब्लम्स है मेरे हस्बैंड में, भाई में, बहन में, तो कम फॉर ट्रीटमेंट इमीडिएटली. सो सो समबडी आई रिमेम्बर केम टू मी एंड टोल्ड मी कि सर मुझे स्ट्रेस है, पढ़ाई का स्ट्रेस है. तो ही वॉज अ 9th स्टैंडर्ड बॉय एंड आई टोल्ड द पेरेंट्स कि ही नीड्स काउंसलिंग. सो दे सेड कि सर आपका डायग्नोसिस क्या है? ऐसे डायग्नोसिस तो कुछ भी नहीं है, उसको पढ़ाई का स्ट्रेस है, दैट वुड बी माय डायग्नोसिस, उसको और कोई बीमारी नहीं है. सो दे सेड नहीं, फिर हम ऐसे बीमारी नहीं है तो व्हाई शुड वी गो फॉर काउंसलिंग? सो आई टोल्ड देम कि उसके मन में मोह चाहिए, ऐसे सोचो. अगर मन में फ्रैक्चर हो जाएगा तब तक आप रुकोगे तो बहुत देर हो जाएगी. So I said, when you sprain your leg, you put a crepe bandage, you take some painkillers for 10 days to prevent a fracture. Keep that leg high. You don't walk for a few days. But if I continue to walk, I said, it will end up in a fracture. So I said that आप एग्जाम की उसको चिंता है, if he's worried about exams, we rather help him cope. No, we don't want him to go to the paper and then break down there and have a problem. So we are helping him cope. So a lot of people have to realize that you're seeking help for self improvement, of yourself and your partner, both, or your family member. You're not seeking help because there is a disorder. So and many a times, people feel that the psychiatrist will prescribe medicines. No, I don't. At least myself and a few other senior psychiatrists, I can vouch कि no one you just prescribes medicines. And let me tell you, even if a doctor prescribes medicines, अभी लेना नहीं लेना, you can always take a second opinion, decide what you want. We cannot shove medicine down your throat, even if we tell you that we're going to prescribe. So don't feel bad. And remember, even narcissism, please, I tell everybody, it is at three levels. One, it is at a psychological level. That is what we've discussed. There are social factors that also lead to narcissism, like multiple things. We discuss so many social situations. And in the brain, there are biologically chemicals also which are up and down. Now, sometimes if a narcissistic individual is very aggressive and he may hit someone again and again, break things, I may medicate him to reduce the aggression, so that so the many times the wife or the family members comes back and says कि सर गुस्सा तो आता है उसको, बट अभी लास्ट एक महीने में ना घर में कोई तोड़फोड़ तो नहीं हुआ है और हमको किसी को मारा नहीं है, तो एटलीस्ट आराम है, थोड़ा चिल्लाए मतलब ठीक है, वी डोंट माइंड. बट और वो जल्दी शांत भी हो जाते हैं. सो दैट पार्ट विच इज डिस्ट्रेसिंग, has been removed. I can't change the individual, but certain parts maybe. I mean, what I'm trying to convey to people here is that medication is not sometimes suggested for the disorder. It may be suggested for certain symptoms. So, or if sometimes I know a lady came to me who was very depressed because the husband had narcissism, and I told her, Ki, why don't you take an antidepressant for 2 3 months? We will stop it in 2 3 months once the counseling kicks in. So she said, how will it help me? आई सेड अभी अगर आप 2 घंटा रो रहे हो सकता है आप 15 मिनट रोएंगे, इट मे हेल्प यू फ्रॉम दैट पॉइंट ऑफ व्यू. सो एंड शी एक्चुअली केम बैक आफ्टर अ मंथ एंड सेड सर ये दवाई लेने के बाद मैं थोड़ा उनको जवाब देने लगी हूँ, मतलब मेरे में थोड़ा पावर आ गया है, तो मतलब मुझे अच्छा भी लग रहा है. पहले कुछ काम करने का मन नहीं होता था, अभी मुझे थोड़ा थोड़ा बच्चे के मैं अपने आप को डाइवर्ट कर रही हूँ, थोड़ा बच्चों के साथ बाहर जा रही हूँ, संडे को अपना अलग टाइम स्पेंड कर रही हूँ, और वो कुछ बोलते हैं ना तो मैं थोड़ा तो सुना देती हूँ, हालांकि मैं ज्यादा नहीं सुना पाती हूँ. बट सो सम चेंज इन हर पर्सनैलिटी हैज ऑल्सो कम अप which has helped her cope. Now, again, I will not say that we removed her medicines in 3 months or 4 months, because through counseling we had helped her. But that same lady came back after 9 months and said, "Sir, अभी मुझे वापस आप 3 महीने के लिए थोड़ा दवा दे दो, मैं वीक हो गई हूँ, ऐसा लग रहा है मुझे." So so she also developed that understanding that let me, and मेरे बच्चे का 10th का एग्जाम आ रहा है, तो ये 3 महीना मेरे लिए बहुत इंपॉर्टेंट है, तो आप मुझे दवा दीजिए ताकि मैं बच्चे को भी संभालूं, हस्बैंड को भी संभालूं. सो द होल एम वाज नॉट टू मेडिकेट हर, नॉट टू डायग्नोस हर, नॉट टू लेबल हर, बट टू हेल्प हर. So this is what I would tell people, that we don't always medicate, but sometimes if the need arises, we may suggest. The choice is always yours, whether you want to take medicine or not.
No, thank you, sir. I think this has been a very wonderful conversation. And is there a way in which, as you rightly said with your series, which you have mentioned, And there are a lot of like murder series which keep coming, which like Murders in Mahim, etc., which I have kept watching. Is there a way to de-link the kind of stigma mental disorders or personality disorders have uh, with something called evil? And is there a way we can create more awareness where this thing can be de-linked and more awareness can be created?
Yes, I think the one very important thing is to have conversations which people don't have. And I always tell people that it is very normal to be depressed. It is very normal to be anxious. These are all normal emotions. इसमें कुछ गलत नहीं है. गुस्सा आना कोई गलत बात नहीं है. लोग हैं गुस्से वाले होते हैं. But it's just that when it becomes extreme, then we need to treat, and we need, like, so many people tell me my husband is short tempered and he'll get angry, but then after 10 minutes he'll come and say sorry, I should not have got angry or whatever. So now over the years I know he will get angry, but he will settle also. But no, if he's getting so angry that he will slap you or he will break the TV, or then of course it's abnormal, it needs help. We cannot tolerate that, from that matter. So now they said, kid, when he's getting angry, he shouts. So we all in the family tell everybody, keep quiet, don't say anything. So in 10 minutes, he will settle. But if at that time we tell him something, it will increase his anger, that way. So these kind of things also happen. And always remember, physical disorders and mental disorders are linked, like you mentioned. So I always tell people, if he's getting very angry, check his blood pressure also. Maybe he's having high blood pressure, which is not treated, which will need help. Like someone told me that my husband is getting very irritable. I said, get all his blood tests done. I get every patient's blood test done because sometimes diabetes may be undetected, cholesterol may be undetected, thyroid may be undetected. If nothing else, vitamin D and B12 deficiency may be undetected, which may need to be treated. And sometimes that also causes a huge reversal. So children, I've seen so many children, they say, padhai mein focus nahi ho raha hai, I'm not able to remember. And parents say he has some attention disorder, you will treat. And I say, no, first you get his blood test done. And we found B12 and vitamin D were low because children don't go out in the sun and play. And when we have treated that, they've been back to normal. So there's never, sometimes the causes can be physical also. We need to rule that out also.
Thank you, sir. Thank you very much. I think we'll come to the end of this conversation. So just to sum it up, based on what Saraswati and you mentioned, that all of us have these traits, narcissistic traits, and I think we'll have to watch out for early signs when it turns into a disorder and becomes extremely destructive for people around. Maybe the person himself will not immediately understand it. What is the one last thing you would like to communicate to all the listeners who are basically caregivers here? So all of us are caregivers, and we have people who live with disorders. So what is one thing you would like to speak generally and also about narcissism and narcissistic personality disorders?
Okay, so I think about narcissism and narcissistic personality, what I would tell people is, don't get overwhelmed and worried by it. If you feel a loved one has a problem, take an opinion, before self-diagnosing. That I think is very important. Or before labeling and before, thinking that it's the end of the world, seek help. And help is available. So there is no problem that way. So that is one. Second, my general message to everybody is two things. If you come across anybody who tells you that I feel life is not worth living, and I feel that, मुझे मरना चाहिए, मुझे आत्महत्या करने की इच्छा हो रही है, please see that they seek help, because every suicide, according to me, is preventable. It is not that we have not sought help at the right time, and therefore it's not being preventable. And I don't know if it may happen in my lifetime, but my aim is that, we should have a suicide-free India if we can. So that is something which is my thing to the general public. And third is, please focus on mental health. It's very, very important. I mean, I always tell people that I work in many hospitals, and I uh, work in a big corporate hospital where there is a big billboard outside the hospital, and they put up, best pulmonologists in the city, best neurologists in the city, best And I always say कि मुझे भी डाल दो मतलब billboard पे. I said कि so they said yeah we will come back to you, but they've never come back to me. Nurse आ गए हैं, what boy अभी आ गए हैं. I said cleanliness का staff भी आ गया है कि we have the best cleanliness. तो I said हम लोग 2-3 psychiatrists हैं, हमको भी डाल दो, हमको भी खुशी होगा खुद को वहां देख के. But no, it doesn't happen. So the stigma starts within us. you know I remember in a conference I asked mental health professionals. I said, tomorrow, if let's say you feel depressed, we're human, you feel depressed, you feel anxious, how many of you will take an antidepressant? Raise your hand immediately. People had to think to raise their hand. I said, that means we are hypocrites. I said, if we are not able to raise our hand. I said, if I said, why will I not take? आई सेड मैं लूंगा, क्यों नहीं लूंगा? अगर मैं दुनिया को प्रिस्क्राइब करता हूं तो मैं खुद भी लूंगा. वाई शुड आई हैव दैट रिजर्वेशन? How many of you will go to a colleague to get a diagnosis? People were reluctant because the stigma starts within us. We feel, अरे उसको मेरे बारे में पता चल जाएगा, he will know, what will happen. The stigma starts within us. So I say no, until we as doctors and other individuals get rid of that stigma. See, today you have online help. सो आपको कहीं जाना नहीं है, आप अपने घर से बैठ के मेंटल हेल्थ हेल्प ले सकते हैं. तो टेक एडवांटेज ऑफ दैट. कोविड हैज ओपनड अप दैट अरीना. इट वाजंट देयर सो मच बिफोर कोविड. So now you can sit in Meghalaya and get a Bombay doctor to see you. So that big help is there. So get help. Opinion तो लो, बाद में ट्रीटमेंट लेना है नहीं लेना है is a second aspect. Take an opinion.
Thank you, sir. I think it was a very warm conversation, and your entire knowledge and you're very articulate in describing with all the examples you have given. And it's a great gratitude from me and Saraswati that we have had this opportunity and time from you to have a conversation on this topic.
Whenever you need me, I'll come.
Yeah,
I'm very happy to be here. Yeah.
Just wanted to thank you for the wonderful talk and learnings we had ourselves during this last 1 hour.
Thank you
Yeah,
so
I would
much,
also
Doctor.
request individuals who are seeing this that you can follow me on Instagram. My Instagram handle is De Sousa Avinash. It has got multiple diary notes. I write a diary every day, which is handwritten by me, and different aspects of mental health are discussed. It's also my WhatsApp status. So, if you want, my Instagram account is open. So you just have to follow and you can follow me. So, I mean,
Definitely.
if you're interested in knowing about mental health, then you will come to know different facets over there. Yeah.
Thank you, sir.
Thank you so
Yeah.
much.
Thank you.
Thank
Thank you so
much.
much. Thank you.
Thank you.